Hi everyone, my name is Dr. Ryan Sinclair, and today we're going to be doing the lecture for the policy analysis and how to conduct the policy analysis. From our last lecture, we could see that policy is defined in various ways. Basically, it's anything, any legislation, rule, law that's there to influence the behavior, action, and decisions of people towards specific goals. And then when you throw public health in, you're intending to control the output towards public health. So public health policy intends to balance power between government, private organizations, and people to protect the overall public's health. So you could have government policies that protect public health as well as industry policies that protect public health, or you could have government policies towards industry to protect public health. And the questions there vary, but essentially government will protect the public health by regulating industry. There's a variety of different definitions of policy, and the CDC document that I have linked in the lesson is going to also have its own definition of policy in general. So policy is a law, regulation, procedure, administrative action, incentive, or voluntary practice of governments and other institutions. So it could be a mandatory or voluntary practice. So what we're doing here in this lecture is learning how to do a policy analysis. And this slide goes over the basic sections of policy analysis, and this is also covered in the textbook that accompanies this lecture. So the first thing to do in policy analysis is have the problem statement, and that focuses the problem and potential options, but it should be limited to one sentence. The next one is background. That presents all the factual information that you need to know about what the story is behind the policy development. Is everything necessary there when you're looking at it and you're evaluating your policy background? And also, what's the tone? Are you being influential or not with that background statement? The landscape identifies stakeholders and their views, and it presents all appropriate information. Options, those address the problem statement, and you present different options in terms of pros and cons and what's feasible, what's not feasible. And then recommendations, and in the recommendations we say that you should only recommend one of the options that you present to keep it simple. So I'm going to have a policy case study here, and so we're going to look at Senate Bill 1000. And so that's the one that requires the county and city governments to adopt environmental justice policies in their general plan. And we're going to talk about SB 1000 in terms of the advocates in Riverside County, which are the Alianza, which I work with, and the CCAJ, which is Community Coalition for Environmental Justice. That one's located more in the urban area, while the Alianza in the eastern Coachella Valley. Those groups are working with the Riverside County Planner's Office, and we've gone back and forth and made several drafts of how they're going to put the SB 1000 into the county plan. Okay, so you hear this number. This is one thing here with this case study. You hear a number, SB 1000. What does that mean? Well, you type it in Google and different things come up, like well, you can have a variety of things that come up actually. SB 1000, the name of a famous bass guitar, but also SB 1000. What it really means in our context is that it's Senate Bill 1000. And so the California state government the legislative government has two sections of groups that meet together, the California State Senate and the California Assembly. And the Assembly has a lot more people and the Senate has less, and the Senate is pretty similar and analogous to the federal government Senate. While every state has two representatives, the Senate is run the same way in the California. While in the state assembly, there's a lot more assembly members in California, and those are only for the state. And so that's why it gives the name SB 1000. Now, when you're working with communities, those numbers and words and letters and acronyms aren't all that helpful, so people give it different names and eventually move to different words to describe things. So here is the California Environmental Justice Alliance. This is the toolkit that they have, and I've linked this also in your assignment as well. And this is a website. It's just calega.org, and you can look for this SB 1000 toolkit. And that's some of the guidance that we've had for this lesson. So I made a little cheat sheet from the last lesson that we had about the who, what, and where of public health policy. Or in order to analyze it, you need to first understand the policy, because if you don't understand it, you're not going to be able to really analyze it. So I just like to ask, who developed the policy? What can those people do, or what can the policy do? What power does it have? Who influences the enforcements, and who can say what power that the policy has? And then where is the policy actually listed? So in terms of who develops them, it's either the legislative, regulatory, or organizational bodies. So legislative, again, that's either federal, state, or local elected officials. Regulatory would be administrative agencies, federal, state, and local. So those are not elected officials, but staff people. And then organizational, which is like workplaces, schools, districts, colleges. Also, things like organizations could be a mixture between regulatory and private. Some things like the AQMD or the Air Quality Management District, for instance. What can they do? We went over this last time in the last video, but essentially it's interventional, police power, for example, quarantine, for example, or influential with incentives. They can guide behaviors in certain ways. Who influences the policy? So that would be things like the federal government, state and local governments, or interest groups. So that's where we come in here with the case study that I'm bringing to you today. The SB 1000, that is Senate Bill 1000. The case study, it's the Alianza and the CCAEJ groups. Those are the interest groups there. And then where is the policy actually listed? Is it in a constitution, a statute, administrative regulations, or in common law somewhere? So that's kind of the who, what, and where of public health policy, and I wanted to just have this as a cheat sheet for it. Anyway, so back to the case study again. The Riverside County, they came up with some policies about pollution exposure and health risk reduction. So this category includes policies that work towards reducing unique and compounded health risks. The following policies address pollution exposure and access to food and encourages safe and sanitary homes. Okay, so let's take, for example, in that SB 1000, they're going through all sorts of things and all sorts of types of pollution exposure. But if we go back to sewage systems, that's the last one down here on the end, safe and sanitary homes and sewers. So assist low-income homeowners as feasible in seeking financial assistance for septic system repair in order to limit groundwater contamination by poorly managed septic systems. So what is that problem exactly? I have some photos here I want to show you. So in the eastern Coachella Valley, there's a lot of issues with sewage contamination. This is a photo of one of my students, Amanda Dupree, who's now in medical school. She's there collecting some sewage samples from next to a trailer in a trailer park. What you see here is that this is just like the sewage comes straight out of the house and then onto the ground. And this is a dry season, so it's not overflowing. But this little dog here would run around and then go inside, and it's a lap dog, so it goes and sits on the laps of everybody. We tested that, and we definitely found that there are Listeria and Salmonella in that sewer water. And so that's an infectious disease risk, and so that's why we have this kind of thing here. Anyway, that's the policy language to tackle that problem. So let's analyze the proposed policy, and looking back at that cheat sheet that I have, who's developing it, what could it do, who's influencing it, and where would this rule be listed? And again, that's the rule there to assist low-income homeowners as feasible in seeking financial assistance for septic system repair in order to limit groundwater contamination by poorly maintained septic systems. So who's developing this policy? That's the Riverside County planners. They're the ones who have to put it in the Riverside County General Plan. And then what will this policy do? Well, it'll be influential. It'll provide incentives for people that are in disadvantaged communities to improve their septic tanks and their wastewater systems. Who influences these types of policies? Interest groups do. So the CCAJ or the Alianza are the ones that influences these policies. Right now, we're actively meeting with these groups to try to get them to change the language in the policies. And where is this policy listed? It's in the county's general plan. And the general plan is kind of a combination between a statute and an administrative regulation. Okay, so moving on from this, what does a policy evaluation do? Well, it uses research methods to systematically investigate the effectiveness of policy interventions, implementations, and processes. And it determines the policy's merit, worth, and value. So it does all of those things in reference to stakeholders or in reference to planners or whoever those stakeholders are, or even the community advocates, to improve the public health, social condition, overall health, and economic conditions. So when an analysis and ultimately an evaluation of policy takes place, there are standards for this, and the book goes over this as well as the CDC framework document that I have for you. Utility, feasibility, propriety, and accuracy are some of those concepts that you should review for that. And then what type of policy analysis are you doing? Well, policy analysis actually on the CDC document comes up here. But what we're doing most of the time for an analysis is a content evaluation. Most of the time in policy, what we have is content evaluation, because in this case with the SB 1000, they're still developing the policy and they're still trying to target the right population with it. We haven't yet got to the point over here where we're evaluating the impact or its implementation. And those are some things from the CDC's website as well. So again, back to the sections in a policy analysis, you want to have a problem statement, a background, landscape options, and recommendations. So in this situation, we have specific recommendations that we're giving to Riverside County's response to our request for the SB 1000 environmental justice element. And those specific recommendations are here. This is part of the language that we're giving them. So in HC 15.1, that the county will, quote, encourage civic engagement. This is not a policy. This is a hope. In HC 15.2, the county states that this will work as feasible to encourage collaboration. Again, this is not a policy. So this use of conditional language is unacceptable. Policies are concrete, not aspirational. By couching the language in the conditional, the county is allowing itself an option to not follow through on EJ policies or to simply check off on community engagement without engaging in a meaningful way. And this option has been exercised in the development of the document that the Riverside County planners created. So this is the recommendation. Let me go back a slide now, and you see the sections in policy analysis. This page that I'm just reading you right there are the actual end result. These are the recommendations that our community coalitions are giving to the Riverside County Planner's Office as part of our policy analysis. And I'm going to leave that off right now for here, and I hope this gives you some ideas on how to write a policy analysis.